So he's got multiple hemangiomas in the bone at different levels. And the reason that's important is because this vertebral body was read as one gigantic L3 hemangioma, which is actually expanding into the spinal canal. And the reason it helps you is you can see here that he's got one here, he's got one here. If we scroll a little bit more over, you can see some smaller ones, boom, boom. And if he didn't have all these other lesions, I might say, well, that's not really the case. Secondly, you know, these could be metastatic lesions of some sort, but he has no back pain. He looks healthy. He hasn't lost any weight. He has no history of cancer. So it really does look, and the signal characteristics of this appear to be hemangioma, but it's expansile. So hemangiomas typically aren't expansile. So I'm going to turn this over to Dr. Tydings now. John, have you ever seen an expansile hemangioma? And the guy's asymptomatic right now. What would you do? How would you manage this?
I mean, obviously that's a problem. And I would also tell them to hold off on golf, because even though we can surmise it's this or that, we really have no idea what this is. So I think we obviously need a lot of information. The chances of this being a primary bone lesion in an 82-year-old guy is slight. So you got to assume the worst case scenario, which is that this is metastatic cancer from somewhere else. So this guy needs a workup, at the least, you know, the usual chemical stuff, all the blood tests looking for everything. I would probably also get a bone scan to see what other areas in his skeleton are affected. And specifically for the lumbar spine, I'd want a CT scan to get a better idea of the architecture. And that'll also give you some of the typical findings of hemangioma versus metastatic renal cancer versus any other type of thing that may give similar answers. But I think in this case, it doesn't look like a simple hemangioma. We need to establish a diagnosis, and then you can figure out what needs to be done from there.
Good point. Anybody know what the lab tests are that Dr. Tydings is referring to that we typically want to get to work up bony lesions, particularly in an elderly person? There's a common disease that they can get that you can do a blood test and a urine test, and you can make the diagnosis. It's called a serum protein electrophoresis and a urine protein electrophoresis, because a person with myeloma will have these proteins that are so prominent in their blood and in their urine that it just pops right up, and it's a diagnosis of multiple myeloma. So
I was just going to make a comment, just like a teaching point. Typically, multiple myeloma, the patient would have back pain.
They would
Right.
have back pain, and the bone would be, what would the bone look like?
Wouldn't it have like lytic lesions?
They'd be totally black. It'd be almost like the bone disappeared in those
yes.
areas, right? Because it's lytic.
Lytic.
So yeah, it would be completely, it would be almost like it disappeared. If this was a multiple myeloma, this vertebral body would be basically dark on an X-ray. It'd be pretty surprising that he would have multiple myeloma, because it would be quite advanced at this time. But as Dr. Tydings points out, you got to think about the worst and then work backwards. And radiologists can be wrong too. They don't always make the right call on this. And you know, this particular reading was, you know, this is what it is, and it really should have been like, this is what the differential diagnosis of this is. Remember, don't just jump to a conclusion. Ask yourself, what are 3 or 4 other things that this could be that I'm not thinking of? That's a lateral thinking technique that you need to use when you're thinking of diagnoses. So his CAT scan is cooking, and we will.
You know, also, anytime you see a lesion in the bone, your worst case scenario is some type of metastatic cancer. You always have to think, could this just be some traumatic where there's some expansion of a fracture? Unlikely with that appearance, but you got to think about that. And another whole area you have to think about is some type of infection, whether it's bacterial, fungal, or other. I mean, lots of things, even TB, can mimic these types of pictures. So it's something to always keep in the back of your mind. And when you have someone you have no idea, you just shotgun all the tests basically at one time to make sure you don't miss everything.